very important because there are certain practices such as prophylactic antibiotics, so antibiotic medication given to all children with sickle cell disease up until the age of 5, which has showed significantly to reduce deaths related to infections. And as I said earlier, infections is one of the major things that can make people with sickle cell disease really sick.
So here in Grenada, we have been privy, luckily for us, to postnatal, right after newborn screening for sickle cell. Tell me your experience with that.
So after med school, I worked in Grenada in the hospital, in the pediatric department as well. So we had a sickle cell screening program where we screened all the newborns just to see what their status is. So do they have sickle cell trait? Do they have sickle cell disease? And if they have sickle cell disease, being able to refer them to the Sickle Cell Association of Grenada to be followed closely, to start prophylactic antibiotics, and to have a mechanism for patients to know that if I have a fever, I need to come in. If my child has a lot of pain, this is why, and these are the things that we can do to give them education on being hydrated, drinking lots of water, which is also very important for patients with sickle cell disease. So the screening program is very, very important. Knowing your status is very, very important. Knowing if you have a trait, if you have sickle cell disease, and what that means for your family.
Right.
So, hold on. How do you screen?
So you screen by a blood test. In newborn babies, it's like a heel prick that you just get small amounts of blood and send it to the lab to be tested. A drop of blood to be tested. So it's fairly simple getting that screening done.
Okay. Just a quick question. You mentioned a couple of times, of course, with screening, it can help determine whether the patient has sickle cell trait or sickle cell disease. What's the difference?
So sickle cell trait is where you have one copy of the defective gene. When you have sickle cell trait, you don't have the disease, so you can lead a normal, healthy life. With none of the complications like pain, like increased risk of infections and all the complications associated with sickle cell disease. However, it's very important to know your trait status because having a trait means that you have a chance of passing on that genetic defect to your offspring. And if you have a child with someone else that has sickle cell disease trait, their chance of having sickle cell disease. That's why it's different from the sickle cell disease, because with sickle cell disease, you have 2 copies of that genetic defect. So 2 copies.
One from each parent.
One from each parent, yes.
Okay.
So I want to ask you the Grenadian question, okay? Can you catch it?
No, it is not contagious. You can't catch it. You can't. Being around someone with sickle cell disease, you don't pass it on like that.
Can I say then, I used to have sickle cell disease, but...
So once you have sickle cell disease, unless you have some newer treatment like they have available, like experimental treatment like a bone marrow transplant and gene therapy, you're going to always have sickle cell disease. It doesn't go away.
Right. So can I, if I have sickle cell trait, can it get upgraded? These are questions that people ask.
That's a very good question. Once you have sickle cell trait, it cannot change. So it doesn't go from sickle cell trait to sickle cell disease. If you have sickle cell disease, it can go down to sickle cell trait.
All right. So what challenges that? Okay, I have a baby. Kind of unlikely at my age, but let's say miraculously I had a baby. Right? Let's say a baby is born in a hospital and we screen, okay? And we discover that this child is likely to have sickle cell disease because we do check at 6 months again just to confirm that this baby has sickle cell disease or not, right?
Yes.
what would you tell me as a mother of a child with sickle cell? And maybe I would know because probably I have family, because for my child to have sickle cell, I have to be a carrier, and maybe the other people in my family, right? What would you tell me in relation to caring, special caring for my child, to make my child have as normal as possible a life and as long as possible a life?
That's a very good question. So for children and patients with sickle cell disease, there's lots of things that we can do to improve the quality of their life, decrease the amount of pain episodes and handle those pain episodes, decrease their risk of infection and handle infections once we be very vigilant. Patients with sickle cell disease can live long, healthy lives if they manage their symptoms well and be very attentive to their bodies. So for someone with a baby with sickle cell disease, we'll talk about the importance of watching for signs and symptoms of pain episodes. If the baby is like really fussy, if you notice swelling in their fingers and toes, which is one of the signs and symptoms that babies can have, it's called dactylitis. That's a sign of a pain crisis in their fingers or toes.
So it means that the blood vessels are being clogged by these crazy sickled cells.
Yes.
Because they have a great potential to stick up together. For some reason, they like to get sticky and stick together and clog the small arteries. Is that one of the things? So we have dactylitis. Yeah.
Another complication, as I said, is fevers because of those same blood vessels clogging an organ called your spleen. The spleen doesn't work well. The spleen helps fight infections. So if the baby has fever, even if you think it's a cold or everyone else in a family who doesn't have sickle cell has a fever too, it's very, very important for them to be seen immediately. You should not keep them at home with a fever. That's one of the things that have shown to increase the lifespan of patients with sickle cell disease, treating all fevers as an emergency. What other thing that's very important is giving them their antibiotics. So patients with sickle cell disease are on penicillin or amoxicillin for the first 5 years of their life, because that's the age, children get sick really often and have high incidence of getting sick. So that antibiotic has been shown to decrease the risk of very serious bacterial infections. Other things to do is to make sure the baby stays really hydrated. Once they're older and able to drink water.
Speak to that. I want you to speak to that, to the Grenadian parent, the grandparents, teachers, everybody who's listening tonight, the importance of remaining hydrated, what you mean by hydration, and why is it important to remain hydrated? Because we have seen, because we know that fever as well can lead to the child becoming quite dehydrated and increase the potential for a child with sickle cell disease to die prematurely. So I want you to speak about hydration and why it is so important for the child's comfort and longevity and wellness.
So being hydrated, especially living in Grenada, we know it's always hot. Keeping hydrated is just really, really important. So your sickle cell, we said that it's kind of sticky, the blood doesn't flow well, your blood levels are also low. So staying hydrated helps in so many ways. Being dehydrated increases your risk of pain crisis, increases your risk of just complications, and those blood cells getting stuck. They can get stuck in your brain and you can have a stroke. They can get stuck in your lung and you can have something called acute chest syndrome, which is something that is associated with high mortality, and that just means chances of death. It can get stuck in your extremities and cause lots of serious pain crisis. So staying hydrated is really a very good way to help decrease the chances of those things happening. So patients that are in school, being able to have access to drink water frequently during the day is very, very important. Also, sickle cell disease can affect your kidneys. So that your blood vessels basically go to every part of your body. So any part of your body that the blood vessel goes, sickle cell disease can affect. It can affect your kidney. You can have kidney disease. So drinking water helps with preventing damage to the kidneys as well.
Are there different types of sickle cell diseases?
So there are different types of sickle cell disease, and it just talks about where the defect is. So it's something called, you will hear people say sickle cell SS, the type that they have, which means they have two defects in the types of the S gene. So the S is the sickle cell, they have two of those, they have that. You can have sickle cell SC disease, so you have one S, one C. Patients with SC disease tend to have less symptoms, but it's variable from person to person. So they can have a severe disease as well. There are lots of different letters. There's like SE, which is like less severe, and there's also something called thalassemia, which is another type of blood disorders. And if you have that and sickle cell together, you have sickle cell disease. So there's many variations, but in Grenada, the most common types are SS disease and SC disease, but they all are treated the same. So we kind of just go with sickle cell disease as like the umbrella term.
Oh, okay.
Go, Godfrey.
No, I was just going to ask. So you mentioned thalassemia. Is there a difference between that and sickle cell, or it is one of the type of disease, or it's different?
So there's many blood diseases of the blood, and thalassemia is one. It's another mutation in the hemoglobin, just a different mutation. Patients with thalassemia alone can have various ranges from severe to mild disease, but when they have thalassemia along with sickle cell disease, then they have the complications of sickle cell disease, which is pain, infections, things that I spoke about.
Mm-hmm. What about any connection with things like jaundice or things like that?
So patients with sickle cell disease, their blood cells have a funny shape. It's shaped like a crescent or a sickle, and that makes your blood cells not last as long. So a normal person with normal blood that doesn't have sickle cell disease, their blood lasts about 120 days. But with sickle cell disease, it lasts lot less. Mm-hmm. So your the red cells break down more quicker. And when your red cells break down, it releases things into your blood that can cause jaundice, so bilirubin, so you can have yellowing of the eyes. That's another way that parents, and we tell parents to look out for. So if you see your child's eyes is getting more yellow, it shows that they're having more breakdown of their red blood cells, so they're having a crisis. So that's something else to bring them in to be seen, increase their water intake, things like that.
Right. In terms of the severity of the crisis, let's say, for example, the pain crisis, is there any difference between the genders, male, female? In other words,
that's a good question. No difference between male and female genders in terms of pain and how severe. Mm-hmm. From one patient to the other, the severity of the crisis may differ. But imagine, like, if people who have broken a bone, how painful that is. You're basically having sickling in your bones and having just really bad pain. Some patients have really bad pain constantly, so it can be very, very severe.
Right. What about women and pregnancy?
No, can we leave that for a little later? Because I want that to be a whole chapter on its own.
Mm. Okay.
Can we speak about pregnancy a little later?
Okay.
Because I'd like us to look at that, because there have been so many conflicts and we've had challenges in Grenada. Because speak to vaccination and the importance of vaccination, especially in our younger sicklers.
So vaccinations are very important. So vaccinations, the main purpose of vaccinations is to prevent infections, and specifically the infections that I spoke earlier about, your spleen and your spleen not working well when you have sickle cell disease. And there's some infections that your body needs a spleen to be working properly to fend off, especially something called meningitis. So that's basically an infection that you get where it's an infection in your brain. It can cause death. and some certain types of like pneumonia and pneumococcal infections. And those vaccines especially are just really important for patients with sickle cell disease, because we know patients, just through research and over the years, patients that have these vaccines tend to get less infections with these specific bugs, because what the vaccines does is gives your body the ingredients to be able to fight off if your body sees this infection again. And we already know that the spleen not working good, so your spleen is not going to be able to fight off the infection. So getting vaccinated is very, very important.
Mm-hmm.
So I want to talk about the spleen. What does this organ do? Where is it in our body? What does it do specifically? What does it produce that makes us keeps us away from the risk of getting infection?
So your spleen is in your belly, in your abdomen, on the left side. It's this organ that is what filters the blood in your body. So all your blood goes through there, and it also helps you fight infections. So bacteria in your blood that are encapsulated, and that just means has like a hard coat around it that protects the bacteria, and it's so hard and resistant for your body to fight. So your spleen is very important in fighting those specific types of infection. So when your spleen is not working well and you have these infections that can cause you to get really, really sick, can cause you to die, can cause you to be in hospital for a very long time because you're so sick, and your body cannot fight those infections if your spleen is not working properly. And also parasites, stuff like that. Your spleen helps your body fight those infections.
Right.
So it's important. It's important. Hold on. So it's important that our patients with sickle cell get the regular vaccines, especially like the pneumococcal vaccine, which is very important to prevent pneumonias and other infections. Godfrey, want to say something?
Yeah, I was asking earlier. You mentioned the importance of being hydrated. With sickle cell. The other side to this, what about food, diet, kind of thing? Mm-hmm.
So having good nutrition, a good, well-balanced diet. So eating vegetables, fruits, protein, eating healthy helps, because we know in general for anybody, eating healthy helps your body be strong, helps your body be able to fight off infections. So especially with patients with sickle cell disease, having good nutrition would help you in the long run, help you with your pain, help you fight off infections, just help you be and feel better as well.
Okay, wonderful. Doc?
So the big question, Miss Anyka. So when I have anemia, right? Me, or anybody who doesn't have sickle cell disorder, my blood, anemia means, we call it weak blood, your hemoglobin level is low, your low store iron, whatever you want to call it, right? I can go to the pharmacy and buy some iron tablet.
So patients with sickle cell disease, the reason for their anemia is not low iron. So their iron stores are actually sometimes high because their red blood cells are breaking down very frequently, and your body stores your iron in your red blood cells. So sometimes their body is already so full of iron. The problem for their anemia is not that they need iron, but the problem is because their red blood cells are not shaped properly, so they're breaking down fast and they don't live as long. So your body is not seeing that red blood cell for the normal period, so the numbers are lower because of that.
So what do we do? What would you advise your patients? What do you advise your patients who may become anemic? Even your sickle traits, people with sickle cell trait may have anemia. What advice should we give to them in relation to feeling better, especially pushing for the nutritional practices to be optimal and avoid them becoming anemic, or at least so they can have a better sense of feeling well? What advice do you give somebody who say, "Oh, somebody come to a hematology clinic, okay? Come to your blood clinic, and they have anemia. We check and you say, you have sickle cell trait, or you have sickle cell disease." What concrete advice would you give to that patient or the mother for the child?
So in terms of medications, sometimes you can use folic acid. So folic acid is a supplement, not iron, because iron, as I said, you don't need iron supplementation. Folic acid can help. Healthy diet, eating healthy, exercise helps a lot too. Being active, drinking a lot of water, having a well-balanced diet. Those things help. For sickle cell disease specifically, there are different medications, and we can talk about those that can help increase your your body's ability to produce red blood cells. One of those medications is called hydroxyurea, and that has significantly improved. So what it does, it helps your body produce a type of hemoglobin called fetal hemoglobin that is present typically only in babies, that those fetal hemoglobin cells don't have that sickle cell defective red blood cell mutation. So when you take hydroxyurea, your actual numbers, so patients with sickle cell anemia, their blood numbers can run from anywhere to like 5 to 7. Normal for context is 11 to 13, depending male or female. So they run very, very low. Patients that are on hydroxyurea, their body's producing that fetal hemoglobin, and their hemoglobin levels can go up. So they typically feel better, they have more energy, they have less pain crisis, so that can help as well. And there are different other medications and different other therapies now being studied and researched for patients with sickle cell disease.
Thanks. Anemia. That's what was anemia. We don't do a lot of genetic counseling in this part of it, in developing nations, because I remember the importance. The people in Boston were talking about, they do premarital genetic counseling. We don't do. We just got married John because we like him. Okay, that's the truth.
Yes.
What role do you think something like genetic counseling have in helping us to recognize the severity and the challenges that sickle cell disease can bring into families?
So genetic counseling, knowing what your genetic carrier status is very important, because as I said, the only way to get sickle cell disease is if two people, mother, father, both have sickle cell trait, or sickle cell, or one has the disease and someone else has the trait. So knowing, especially if you have sickle cell disease, knowing the trait status or the status of your partner is very important. Genetic counseling is very important because premarital, especially before you have a child, because if you know you have sickle cell trait and that person has sickle cell trait, knowing the risk for having a child is very important, so you can make informed decisions and it not be a surprise after a baby is born.
Right. What about someone who has sickle cell disease, but their partner is free? Having a baby, what happens here?
So if the person has sickle cell disease, mother or father, and they have a baby with a partner that does not have sickle cell trait, so they are AA, which means 2 normal hemoglobin, the patient would have 50% chance of having sickle cell trait.
But not disease.
Not disease.
Okay.
To have disease, you have to have both parents with at least the trait to increase your possibility of you getting. If one parent has full-blown sickle cell disease and the other one does not have any sickle cell gene, the child is definitely going to have the trait.
Yeah.
But is not going to have the disease. So I'm going to come to the question that that Godfrey mentioned.
Okay, so before we do that, Doc, before we do that, let's just take a quick break. We need to take a quick break, and then we're going to come back and go to that. So stay with us, folks. We'll be back with you in just a moment.
Hello and welcome to the live Super 6 draw presentation for this evening, Tuesday, the 17th of June, 2025. I am your hostess, Kijan Smith. Super 6 is a multi-jurisdictional game owned by Winlord Inc. and is played within the islands of St. Vincent and the Grenadines, Dominica, Grenada, and St. Lucia. Tonight's jackpot is valued at $270,000. We'll now get ready to select your free ticket letter. Good luck. Your free ticket letter is J. Please stay tuned. We'll be right back with tonight's winning numbers.
More jackpot money, more reasons to play this game. More money for way. Super 6 a bigger jackpot game.
Now you love Super 6 even more. With more money.
The jackpot galore. Play more. Win more. Have more fun.
With more jackpot money,
Super 6 is my number one.
With the new and improved Super 6 team, the jackpot keep growing and growing.
I'm growing.
more jackpot money, more reasons to play this game. More money for way. Super 6 a bigger jackpot game. Super 6, bigger jackpots, more chances to win.
Great news about Super 6. You can play Super 6 combo bets to increase your chances at winning the Super 6 jackpot. Here's how. The combo 5 betting option costs $69. Players have a choice of any 5 numbers, and if you match 5 of the 6 numbers, you win the jackpot. Maybe you prefer combo 7, costing $21. With a choice of 7 numbers, and if you match any 6 numbers out of the 7 numbers, you win the jackpot. How about combo 8? This option costs $84. Players select 8 numbers, and if you match any 6 numbers out of the 8 numbers, you win the jackpot. All numbers chosen should be from a range of 1 to 28. Play combo bets. Remember, with Super 6, there are bigger jackpots and more chances to win.
Welcome back. Get ready for your Super 6 winning numbers. Good luck. Number is 16. To recap, your Super 6 winning numbers are 21, 22, 20, 13, 28, and 16. Your free ticket letter is G. Tonight's winning numbers were drawn under the supervision of an auditor from BDO. Please contact your relevant Central Lottery office for further information on the payment of prizes. Thank you all for playing responsibly, and remember, with Super 6 there are bigger jackpots and more chances to win. Our next Super 6 draw takes place on Friday, the 20th of June 2025. Until then, have yourself a wonderful evening.
Welcome back, everyone. It's Doctor and Call, and for those of you who joined us late, in case you missed it, our very special guest this evening, Dr. Anyka Clouden-James. She's a pediatrician, and tonight we're talking about sickle cell. In fact, on Thursday this week, it's World Sickle Cell Day, and in Grenada for the entire week, there's going to be some activities related to that. And of course, later on, Doc is going to share with us a little bit more about that. So we continue with our discussion. We've looked at, sickle cell, what it is, how you get it, a number of other things. Doc, sickle cell, and you were about to speak on the issue of pregnancy, I guess it was?
Yes.
Right.
I wanted to speak about, before you go to pregnancies, can you just speak about hydroxyurea as a anti-agglutinant?
So hydroxyurea is a medication that has been shown to improve the quality of life of patients with sickle cell disease, meaning that it helps improve pain crisis. And pain crisis is one of the things that a lot of patients with sickle cell disease have, and it can be something that can prevent them from being able to go to school, go to work, just because of significant pain, have long stays in the hospital just to get good pain control. So sickle cell disease, hydroxyurea increases a type of red blood cell production called fetal hemoglobin, which decreases the number of your body's sickle hemoglobin, and that's what really helps with the pain and helps with other complications because it decreases that type of hemoglobin. It also helps.
We don't have cells that stick together as much.
Yes,
because that's what causing us to have all that pain, that clog up, and there's no oxygen beyond wherever that clog is.
Exactly. So imagine you have a pipe and there's you have it clogged and there's downstream from the pipe, everything is just building up. So it's just like lots of pressure, lots of pain. So it helps decrease the number of those cells that are sticky and that are sickle, that are blocking things. So it helps with pain. It helps increase your red blood cell number, so you feel better because you have more cells that can carry oxygen to all the rest of your body. You have more energy. It decreases stroke risk for the same way you have pain. The blood cells going to your brain can get clogged as well, and you can have strokes with patients with sickle cell disease. It's one of the really bad complications. So it helps with that as well.
Children.
Yes,
or children
that
can have stroke. That's one of the things we need to recognize, and why it's so important to have our children hydrated, because of that possibility of having the little arteries in their brains clogging very easily, because you have these cells clogging together.
Right.
Yes, so it's very important for that.
Right. Doc, just before you go, out of curiosity, can someone maybe for whatever reason, because we did say that the whole sickle cell issue is genetic. What are the possibilities or chances of someone maybe for whatever reason, possibly someone getting into a terrible accident, develop sickle cell?
No, so you can't develop sickle cell. You have to be born with it. So there's some people that never got tested when they were younger, and they discovered that they had it, probably older in life, but that means they would have always had it. So you are born with it. You can't develop it, and it can't go away. Once you have it,
I've had older patients in their 60s and 70s who've been diagnosed with sickle cell trait. Simply because they haven't had much clinical manifestations. As a matter of fact, I had a patient who is 76 in the last year. He came and he had gone away and got when you scrape your shin and it wouldn't heal. I know him to have diabetes, not very, very, very well controlled, but I decided I was going. He says, every so often, and then I said, "Do you have sickle cell in your family?" He says, "Well, he thinks one of his sisters may have had sickle cell trait. Perhaps he was sickle cell positive, right? He had sickle cell trait." So there are a lot of older people, and remember, we have not always been testing, right? And maybe we should speak here about the importance of proper antenatal care and the challenges that not having proper antenatal care brings. Because if you do not know that you have sickle cell or sickle cell trait, everybody in Grenada who becomes pregnant and goes through the normal antenatal care is screened for sickle cell. Okay? Yes. Recently, we have been trying as far as possible to screen as many people out there. I believe that we should focus a lot on our men, so we can know what's going on in the community, right? So we have been screening, and we've been finding a lot of people who have the trait, mostly those with the trait, because, like you say, the ones with sickle cell disease may have health challenges, may have failure to thrive manifestations in the physical being. We kind of need to know, so we screen. But what if you don't know who your baby father is?
Yeah.
Right? What if you kind of tell your husband who don't know nothing about the child that it's his child? Your daddy ain't your daddy, but your daddy don't know. And there are lots of permutations of that possibility, right? What if your husband doesn't know that he has sickle cell trait? It's important that we screen our adults, right? Just in case you don't know. And I want to take this moment to invite people, like whenever you hear that the Sickle Cell Association is at a health fair, we've been doing a lot more of that recently, to go and screen. If you're a young woman who has never been pregnant, or a young man, boys, right? Young men, go and get screened. Because what if you die before your partner discovers that she's pregnant and you carry the gene? There are a lot of things can happen. It's very important that people know their status. Do I have sickle cell? Do I have the sickle cell gene or not? Or do I have two manifestations of the gene, something from my mother, something from my father, right? And so that my antenatal care, the care that I get while I'm pregnant, can be specific, can be very disease focused, and focus at delivering a normal, healthy child from a mother that survives the ordeal of pregnancy. The fact that we know pregnancy is a disease a condition in which we have more cells circulating, right? So if you have more cells, the more likely those cells to stick together.
Yeah. Okay?
The more likely you can have crisis. But also, it can cause other problems. A pregnant woman can have a stroke. She can have a lung syndrome. She can have wherever it's possible, she can have. So we need to know. All right? I think it's a responsibility for everybody to get a chance. It's there. It's simple, right? And screen. Those of us who have not been screened. There was a time, I think, like kids over 10, 12 probably have not been screened because the program was not on for screening at that time. But I think there was a time when people didn't screen. And if you're going to become pregnant, you need to go be able to do those basic tests so you can figure out what is the fate of the baby and how you should be managed, right? we know that there's a greater need for hemoglobin during pregnancy, because your baby is going to take all the food at once. So you need to have these red cells that can carry food through, so the baby you can have a healthy baby. So in knowing your status, you also contribute to how the outcome of your pregnancy and the health of your baby. I wanted to speak, however, to the issue of pregnancy on its own.
Doc, I wasn't finished. Just before you go there, because I'm a little curious, and I know Dr. James mentioned, well, you cannot develop sickle cell. You have to be born with it, but it had to come from somewhere. So the story about sickle cell evolving to fight malaria, is there truth in that?
So basically the theory is patients, it's prevalent in areas that have malaria, and because of the shape of the sickle cell, so malaria affects your red blood cells, and because of the shape, patients that had sickle cell disease, not that it evolved because of malaria, but patients that had sickle cell disease survived more than patients that did not. So it spread is what it is. So it's not that it got there because of malaria, but those patients just live longer to have children, is the theory why it's more prevalent in countries that have a higher incidence of malaria.
Okay, so there's nothing.
Those cell walls are a little harder, so it's difficult for the bacteria that causes malaria to penetrate into the red cells, and that's how they protect.
Okay, so your sickle cell is there. It's just that if for some reason you contract malaria, you stand a better chance of surviving the malaria, but your sickle cell is there. Okay.
Yeah.
All right. So Doc,
So let's talk about pregnancy.
Right.
And why it is such a
challenging time.
Yes, a precarious state, not only for the woman, but for the people who manage her, especially in resource efficient countries and environments like us. Can you speak to that for a few minutes?
So pregnancy on its own, we know, have lots of complications. So your body is taking care of and growing another human, and that means that your body needs to increase its blood volume to supply not only your needs but also the baby's needs. Your pregnancy is what they call a hypercoagulable state, which means that your body is just doing so much. Your heart is pumping faster. Everything is, and all the hormones that are there to make the child grow, makes your blood in itself more sticky. So you have more, you're more prone to get like blood clots and blood clots in your lung. That's for a patient that is without sickle cell disease. A patient with sickle cell disease who is already at a higher risk of blood clots, at a higher risk of their blood being sticky because of the sickle cell disease, a higher risk of all those complications like stroke, like a pulmonary embolism, which is a fancy term for a blood clot in your lung, acute chest syndrome, which is an infection in your lung, which is caused when your blood cells get stuck in your lung and you get an infection on top of it, DVTs, which means blood clots in your leg, ulcers, strain on your heart, because sickle cell disease can also cause heart problems because your body is operating with less blood than it should have. So your heart has to pump faster and stronger to be able to circulate and to do all the things that you need it to do. So on top of all of those complications that you already have, just because of sickle cell disease, pregnancy increases all of the risk. So it's just a very, very high risk time for patients with sickle cell disease. Before there was lots of interventions and things that we can do to handle lots of complications. The advice was for patients with sickle cell disease to not have children. The advice is changing in certain contexts, but still in our context where we are resource limited just because of our size, and just how expensive some of these therapies are. It's still just very high risk, not only for the mother, but for the baby. So we know baby needs blood to grow, to develop, to grow to the correct size. So patients with sickle cell disease, the blood cells can clump up on the placenta. That's what supplies the baby with all the nutrients, all the blood to grow, so the baby can have failure to thrive, which is a fancy term for not growing properly. There can be stillbirths. There can be just lots of complications, lots of complications as strokes, blood clots in your lungs, heart failure, meaning that your heart is just doing too much work and it's pumping so hard that you can have complications. With all the complications, there are things that you can do to combat it, but being very compliant with medication, being very compliant with recommendations from the healthcare providers. In some countries, they do routine like blood transfusions just throughout pregnancy, so your body has less of that sickle hemoglobin and more of the normal hemoglobin. Medications like hydroxyurea, which, as I said earlier, increases that fetal hemoglobin, so your body going to have less of that sickle hemoglobin, and just very frequent monitoring and checking, which sometimes is not always possible in our context in Grenada.
Yeah, and plus those red cells, you never know when they're going to break down in large quantities, and the mother can become anemic and have challenges.
Yes.
So it's very it's unpredictable how a mother will, a pregnant woman will, how her clinical picture is going to manifest given from one day to the other.
Right. We have a caller. Let's take a quick call. We have a caller on the line, Doc. Doctor and call. Good evening.
Good evening, Godfrey, and good evening to the doctor. I have type 2 diabetes, and at night under my food does be eating me. And when I sleep and wake from my knee go down, does be cramping for about 10 minutes. Could the doctor help me, please?
Okay, caller. Yeah, right.
Okay.
So,
all right. Good evening, Miss, and thanks for calling. Although we were not talking about diabetes, but I think it's always a good time to talk about diabetes. Yeah. So I think, first of all, you should be going to your doctor, because I have the feeling that your sugar is not very well controlled. Or your sugar hasn't been controlled over a long period, that you're having complications, and you may have the nerves in your feet may be affected, right, as happens with people who have diabetes. So here's my suggestion. Go up to the clinic or go to your GP, whoever you see, and make that complaint, because you need to be examined properly. And when you start having problems with burning in your feet in the night and all the rest, it means that those nerves are not working. I would hate for you to step on a stone or step on a pin in the house or step on anything hard and cut your feet and don't know that you have a cut because you're not feeling as much. Because I doubt you're feeling properly. Your sense of touch on the foot is very good. So my advice to you is go to your doctor tomorrow in the clinic, if there's a clinic where you are, or go to your general practitioner and tell them you want them to examine your feet properly, and you need to get your sugar fixed. Thank you.
Right, and call us just in case. The number is 435-2041. If you have any questions concerning sickle cell, or if you are a sickler and you'd like to share your experience or any information with us, we'll be happy to accommodate you. So the number is 435-2041. You can give us a call. And when you're calling, please turn the volume of your radio or TV down and listen to us on your telephone. Right. So we continue. We were talking about the pregnancy. Right.
No, we're saying the importance of making sure that you get proper antenatal care early, right? Because we live in a really resource limited, especially with those complications. There's a greater chance of a mother's demise, and probably the fetus's demise as well, that both of them die, simply because we don't have the specialists, simply because we don't have the facilities for taking, you have ICU and so, but, sickle cell behave like a crazy person. One day, all your cells, you said, we're going to just break down today and make her anemic, right? And because you have all these crazy hormones that go around during pregnancy, it is unpredictable what is going to happen to a woman. It also means that a mother who's pregnant and knows that she has sickle cell disease may need to go to the doctor a lot more frequently.
Yeah.
So do not get frustrated if that should happen. If you're checked for sickle cell, and we discover that you're sickle positive, they will do a second test to see if you have sickle cell disease, right, or just the trait. Okay. Your partner also will need to be tested, so we can figure out what is the potential fate of this baby. So when a baby is being born, we know what to expect with this child who may be born with sickle cell disease and how we go after.
Right. So someone with is it less complicated for, let's say, a woman with the trait during pregnancy than with the disease, right? Because the risks are much lower. Okay.
So when you have the trait, you have more of normal hemoglobin, and the problem is with the type of hemoglobin. So patients with the trait, to my knowledge, can have normal pregnancies without complication.
Okay, fantastic. Mm-hmm.
So one thing I want us to speak about, because it tends to happen a lot among our apart from the painful crises with the feet and stuff. I want you to speak about chest syndrome so that mothers and parents who have children with sickle cell can understand what is this thing and how soon I should go to the hospital. What should I expect? The clinical picture, and what should I do if I think my child is having an acute chest syndrome? So define it and explain to me what I expect to see, and what's my next move as a parent or a caregiver for a child with sickle cell disease.
Acute chest syndrome is one of the bad or worst complications of patients with sickle cell disease because it can be life-threatening, meaning that you can die from it. So basically what happens is your sickle blood is getting clot in your lungs, and it's increasing your chance of infection there. So it comes with a lot of chest pain, shortness of breath, fevers as well. So when you have a change on a chest x-ray, so you can see a pneumonia, or you can seeing changes there. You have a fever, shortness of breath, your oxygen saturation goes low. All of those things happen when you have acute chest syndrome. It is something that needs to be seen immediately. So if you have a child or you are a person that has sickle cell disease and you have chest pain with shortness of breath, definitely if you have a fever, regardless if you don't have chest pain or not, you need to be seen immediately, as soon as possible, that same day, not the next day. If it's denied, that same night, because things can happen and change so quickly that you need to get immediate attention. You would need to be started on oxygen. You would need to have blood cultures done. You need to be started on antibiotics via your vein. IV fluids.
Dehydration.
Exactly. Dehydration can cause that too. And sometimes you even need like blood transfusions.
Mm-hmm. Okay. All right. So another... No, finish, Doctor. Go ahead.
No, I'm saying that is one of the complications we see a lot among our children with sickle cell disease, and parents tend to not go now. Let me see what happens tomorrow. Let's see how he gets better, especially when you're seeing it for the first time. Mm-hmm. So we're saying your child is having chest respiratory symptoms. The chest feels tight, they're having pain, they're coughing. Oh, it's not just a cold. Or let's make sure it's just a cold, right? But that's not your call as a parent. That is the doctor's call to decide whether or not it is just a cold or more. So once your child starts having a chest syndrome, and I think we need to remember as well that chest pain can actually be because of heart attacks, because you also have clots that can go into the blood vessels in your heart and cause you to have a heart attack. And can little children have heart attack? Yes, they can.
Yes, they can.
As well as old people. So we don't want our little children dying from heart attacks. This is too catastrophic. Okay? So we need to make sure that our children that once there's chest pain, that you start moving. Once the child starts showing, or there's any sign of any chest syndrome, any symptoms that are related to the chest, that you take your child to the hospital, to the emergency room as soon as possible. Don't wait till the doctor come in the morning. Go up to the hospital. My child has sickle cell, and he's having chest pain, some symptoms in his chest, right? I think our physicians are relatively well trained to know that, hey, let's make sure that this is not an acute chest syndrome. When do I start taking hydroxyurea?
So the recommendations is from as early as 9 months to start hydroxyurea. In Grenada, I don't know if a liquid formulation is available, and I don't think so. So that might be the limiting factor. But specifically, if for older kids, if you have lots of pain or have any complications for sickle cell disease, you take hydroxyurea. But the best time to take it is before all of those symptoms start. So before the complications start, because once you have complications, it means that your organs are getting damaged. So your kidneys, your eyes, your heart, your brain, your bones, they're getting damaged because of the sickle cell disease. So if you can do something like a medication that you take every day or every other day, depending on the dosage for your age and your weight, so the earlier you start, the better. That's why the recommendation is as early as 9 months.
Right. So Dr. James, you mentioned once the complication starts, the risk of damages to organs and things like that. How does that impact or affect one's lifespan?
So,
span or lifestyle?
Lifespan. Yeah.
So patients with sickle cell disease can have early mortality, which means die early. But there's also patients with sickle cell disease that can live long, normal, healthy lives. The difference is managing the symptoms, getting regular treatments, checkups, even when you're well, to prevent those complications. So there's lots of complications that can cause. It can damage all your organs. I said your kidney, your heart, your brain, your bones, your eyes, your legs. So managing the complications and decreasing the number of events, and working well with your doctors and the nurses, and the nurses in the Sickle Cell Association, going to your appointments, keeping those appointments, getting your check. Sometimes parents feel, they might say, oh, the child looks good today, the child has been doing well, and that's great. We want them to do well. We want them to be healthy, but doing the checkups, taking the vaccinations, taking your antibiotics, all of those things help prevent the complications, and that is what's going to increase the lifespan to a normal lifespan and a normal healthy lifespan, because you want to be able to do all the things, go to school, go to university, play sports, do all the things that you can, but you just have to, it might just look different in how you do it, and taking the recommendations really seriously help you get to that point.
Right. So I have one other question, Doc, before you come in, and very important. I'm asking this for my men folk. Sickle cell and erection. Can it? Men with sickle cell, do they have, or would they develop difficulty with erection? That is, having an erection, or is it the difficulty the other way? Having an erection and difficulty losing the erection?
So there's something called priapism, which is a complication of sickle cell disease where, so your blood goes everywhere, right? And your sickle cell makes your blood sticky. So sometimes the blood goes, and you have an erection that you cannot control in terms of it is very painful. It is not going down because of the sickling, and the blood gets stuck. In terms of having erections and being able to maintain their erections, I don't think there's any issues with that. that once your sickle cell is well controlled. So in that way, there's no complications in that way. But the complication, as I said, is having a very prolonged, sustained erection because the blood cells get stuck there and can't go down.
Right. In a case like
hold on. Don't go beyond that question here, because I think we need to explain to our population, our listeners, what the challenge is with having priapism. You need blood to flow into the penis to get an erection. But because you have all this coagulation, everything just stick up together. At the end of an erection, what normally happens after you've ended the sexual act, the blood flows back out of the penis into the body. In the case of priapism and in sickles, because you have so much blood cells, they almost create a block, and you're not able to lose the erection. So it's not that you want to have intercourse. It's just that physiologically you can't empty the penis of all that blood that rushes in there to create. Now this is an emergency.
That's what I was going to ask. That's where I was going with it. How do you?
Right. So this is an emergency. If you find that you have an erection that doesn't go down, you need to go to the ER. You need to go to the ER, because sometimes, yes, you can get it to come back down. Sometimes you need to have a surgical intervention to help to unclog that artery that's so full of blood and it can't go back down. Okay, because you also don't want to have other complications, because you would have lack of oxygen beyond where the clog is. So the truth is that is an emergency. It may seem embarrassing, but it is not to us, because realize that this is a possible complication happening in males who have sickle cell disease, right? And they have a right to be married and have families and do all the things, because one of the things, that's why I asked what is lifestyle or lifespan. It is important that we keep people with sickle cell, and they as well stay well enough. Parents, and as we get older, parents take care of their children to make sure that you can have a normal life as far as that is possible. So the lifestyle would include hydration, knowledge, first of all, making sure your child gets his vaccines, making sure that he goes to the clinic regularly, making sure that he's able to reach his milestones in growth, making sure that the nutrition that you give your child is appropriate to make sure that he's well, making sure that he's aware of all the possible complications, that he knows when his chest starts hurting, that he understands why his feet hurt, that he takes his medication every day. I know it's very hard to take medication every day. The doctor give you one antibiotic to take a day for 4 days, and you can't even do that. It's not easy for people with that kind of chronic illness to sustain. But it is important as well that families are able to support the person with sickle cell. It is not nice to have a wound on your heel that doesn't heal. On your ankle, that doesn't heal. So we have to try as far as possible to ensure that our persons with sickle cell disease maintain optimal health as far as we can. And it does take extra effort, but we want their lifestyle to be that of the normal person as far as that is possible. But there are things that we're going to have to do, okay? And of course, like I said, if a patient has priapism, that is, you have an erection that doesn't go down, go to the ER immediately, okay? Once it is not coming down, and it tends to be painful anyway, so you need to go to the emergency room so the doctor can see you and try and help you as far as possible to reverse that priapism. It doesn't happen very, very often, but I've seen it. Right. I've seen it happen in my lifetime.
Right. So moving up in the body, vision. If you have issues there, can that lead to blindness? I mean, let's talk a little bit about that, because I think that is important.
So it can. So there's blood vessels that go to your eye as well. So if your sickle blood gets caught in your eye, you can cause retinal hemorrhages, and can lead to blindness, and can lead to just sometimes something called infarcts, so small infarcts in your eye that over time, if they continue to get repeated infarcts, you can have problems with your vision. So that's why patients with sickle cell disease, eye exams are very important as well, just to make sure you keep checking your eyes to make sure that they are doing well, because you want to, our goal for patients with sickle cell is to live a long, healthy life as much as possible. So doing things to prevent things from happening or to catch it early once it does happen to prevent the complications.
Right. I'm getting the feel here. I'm getting the feeling, Doc, that these cells can at any time get stuck anywhere in your body, and can create.
Yep.
And that is worrying, because you have no control over where
at very small vessels in very essential places. So like you don't have, if you have poor circulation, if you have clogging of the arteries in your feet, you can develop ulcers that become very, very difficult to maintain. The same way with your eye or your heart, like we say, or your kidneys or your brain, right? Those cells get into the small artery, into the small blood vessels, and clog it and cause what you call infarcts or death of the tissue around the area where the blood vessel is expected to provide oxygen and food. Simply because the road is blocked, right? And there's no access to food for the tissue beyond it.
Right. So, Doc, we're getting close to wrap up time. So I think it might be a good idea to just sort of just go back a little bit, and just summarize our discussion for that we had this evening. So Dr. James, yeah. Mm-hmm.
So we're talking about sickle cell disease. So sickle cell disease is a blood disorder. It's a genetic blood disorder, which means that it's something that you're born with it. It's not contagious. You can develop it later. You cannot develop it later in life. You either have it or you don't have it. Sickle cell disease is the broad category. There's also something called sickle cell trait. So for you to have sickle cell disease, you have to have 2 copies of that genetic defect in the red blood cells, and those red blood cells are the cells that carry oxygen and food to all parts of your body. So if you have 2 copies of those genetic defects, you get one from either parent, you have the disease. You can have 1 copy and have a normal other copy, and you have sickle cell trait. 2 patients that have sickle cell traits can go along and have a child that has sickle cell disease, and they have a 25% chance of doing so. It's very important to get screened. So all adults, especially our males, especially patients who are thinking of getting pregnant or are pregnant, need to be screened so you can know what your sickle cell disease or sickle cell trait status is and what that would mean for your pregnancy and for your baby. Sickle cell disease is something that has lots of complications and need lots of special treatments and close monitoring, medications, antibiotics because of risk of infection, risk of stroke, risk of heart and kidney and eye disease. However, with proper treatment, with regular checkups, with taking medication as prescribed, with staying hydrated, which is very, very important, you can have a normal, successful life. You just need to make changes to help you get there. It can be frustrating, and that's why there is an amazing organization, Sickle Cell Association of Grenada, that they have like monthly clinics for patients with sickle cell disease and different things to support patients with sickle cell disease, working with your nurses, with your doctors, your general practitioners, your pediatricians to do all the things that they recommend so your child, or if you as a person with sickle cell disease, can have a normal, healthy life. We also talked about the importance of, if you have a fever, if you have chest pain, to go to the doctor the same day, not the day after. If it's in the middle of the night, the same night, to get treatment as soon as possible.
Okay, wonderful. Doc, anything you want to jump in here with?
Well, I'm going to do the local thing. So we have Sickle Cell Association, we have Sickle Cell week next week. On one day, we will lay a wreath at the grave of Walter Clement Noel, our hero, our probably national hero, but our hero. We think of him in heroic terms because here's a person who gave himself to science first, to be who had been investigated so we could understand sickle cell. On Sunday, the 22nd, we have a church service where we give thanks for all. God has been merciful. Right? We've been doing a lot of health fairs around the country. So I'm going to ask people that whenever you hear about health fair, I know there are a couple coming up between the 25th and the 28th. There's a health fair at Food Fair. There's one at Foodland. I think Foodland is Hubbard's on the 26th. And then there's one Embody from Fit Life. I think Fit for Life is having that one. So listen for it. That's between the 25th and the 28th. There is going to be an information session all day Sunday the 29th at IGA. So come and ask questions. I don't know that we're doing screening then, maybe we will, but there's almost always an opportunity for screening. Come if you have any questions, come and your doubts will be cleared up. Nobody will be turned away who has any doubts. And usually, people think that their questions are stupid. The stupider the question, the better for us, because we know that we understand that you don't understand what's going on. It's very important to be able to enlighten people, to clarify their doubts, and to make them informed and give them that amount of power over their wellness. Also, there's one more thing. There are clinics. And the clinics are not only for our children. We have had adult clinics, one in St. George's and one in Grenville. And I'm really sorry, I still forget the days. I'm supposed to have written it down and I forgot. But you can find out, call the hospital and ask when the sickle cell clinic. If you're an adult with sickle cell disease, I promise you it will be well worth their while finding a clinic, because the doctors who are there focus on patients who have sickle cell disease. And of course, our children, we kind of know our children. We lost some kids last year and it was very, very difficult, especially for the nurses who take care of the kids. We don't want to lose any of our people who have sickle cell disease, because there's so many ways to give life, to stay well and stay away. So sickle cell disease is a support group, really and truly. We have taken on the responsibility to ensure that is early post-birth neonatal screening, and that there's a clinic where they can be sick, or only sicklers attend, so they get specific information, they get specific direction as to how they stay. Their medication is made accessible, and of course they get their vaccines, especially the pneumococcal vaccine, which prevents us from getting pneumonias. So that's it. Before we go, there's lots of rain. Please boil your water, because the water looks dirty. On top of it, just the Sahara dust alone makes the water look dirty. Please boil your water for your children. Boil, and let it settle. Please wear your mask if you have asthma. There's a lot of the dust again. Sahara dust is causing a lot of respiratory problems, even for people who have nasal allergies. Okay? Please, I'm asking you. And of course, with the new Hearts Initiative, we're asking patients to make sure that you get into that program where we have medications and a system that almost guarantees proper control of your blood pressure. So please, I'm going to ask you. I know it's crazy season already, silly season. Please don't drink too much. I see people playing jab and fool enough to not let me pass when I want to pass on the road, and other drivers. Please be very careful. Remember the risk of consuming alcohol. All right. And that if we consume alcohol, we increase our risk for getting hypertension, for getting diabetes, and for getting cancers, and of course for dying stupidly, just adventurously, because we lose control. So please pay attention to that, okay? And inclusive, inappropriate sexual behavior that might lead us to have sexually transmitted diseases, including those that are incurable. So that's where we are today. I don't have anything else I want to think about. I want to thank Dr. Clouden James for being here. She's somewhere up in some part of the US that's still probably cold. And we thank her for being with us tonight and for sharing. It's really good to have a young colleague who is heading in that direction to take care of a problem that is so prevalent in our country. Thank you, Dr. Claude.
Yeah.
Thank you so much for having me.
Thank you very much, Dr. Nixon, and Dr. James. Thank you as well. I'm really, really pleased that you've, accepted the invitation to be on the program. Let it be known, though, that we hope to have you back very soon, maybe 2 weeks. You never know, but we definitely would love to have you back. We're looking forward. So thank you so much again, and do enjoy the rest of your evening. Doc, thank you so very much. Thanks to all our viewers, our listeners. We thank you very much for staying with us. Those of you who commented on our Facebook page, thank you very much. And of course, you can join us again next Tuesday for another Doctor and Call. Do have a good night. All the best.
And enjoy the day on Thursday, everybody.